interesting case. I sort of made this point at some point, not that recently, but I found this cool case that kind of shows why what I made the point is important. So you can see this patient had these lesions, multiple lesions in the liver. You can see patient has renal insufficiency, splenomegaly. So, of course, we think about metastases. So the patient came for MR. So in MR, you can see, well, one thing you see is what? This is a 3 Tesla scanner. And we see these lesions and they're slightly hyperintense, so that's concerning. But we also see that the spleen is very dark on T2, darker than the paraspinal muscle. So now we're beginning to think of iron. So this is the interesting part of the case. So what do you guys think about the liver? Like that.
Well, since it's 3T, we need to see the TE and see. Oh, wait, I see the TE. Okay. So
Okay.
It looks like the out of phase is the later echo.
Right.
So we can't use it in our normal way as far as.
Right. So this is an older scanner. This issue comes up less and less as the newer scanners have better gradients. But on the older 3T scanners, the gradients weren't strong enough to acquire the out of phase as the first echo. So routinely on 3 Tesla, the in phase was acquired, out of phase was acquired as the second echo. And this issue actually is still relevant because sometimes techs make mistakes. So this was a cool case because I caught this as patient was on the scanner. We took the patient off the scanner and put her on 1.5 Tesla scanner. So now you can see the difference. And you can see that the spleen still drops. So I'll do this. Oh, I can't, okay. Unfortunately, I can't do 4 like this. So I'll bring it up in a second. But you can see that on a 1.5 Tesla scanner, when the in phase is acquired as a second echo, the spleen, which has iron, drops on the in phase. When we use the 3 Tesla scanner, you can see that the spleen, well, it was already very dark, but you can sort of see that it was darker on the out of phase, which was a second echo. So again, iron doesn't drop on in phase, out of phase. Iron drops on the second echo.
Hey, Victoria, there's a question, or Gitanjali was asking about mixed fat and iron, and this is something that always confused me.
Right. So in this case, if when I'm just showing you this, there's no way to know if this drop, because there is a drop, right? So if you look at it, right, the liver is slightly brighter than the paraspinal muscle and it becomes darker. So there's definitely a drop here. So if this is all I showed you, you really can't tell if there's fat, iron, or both. Now in this case, when you look at the T2, you see that the liver is fairly dark. It's darker than the paraspinal muscle. It's a 3 Tesla. So you know there's iron, but you can't tell if there's fat or not. Because you understand, because the both will cause signal drop on this phase. So this is a cool part of this case, because on the same, this is literally, we took the patient off and slapped, I don't remember, slapped the patient on 1.5 Tesla scale, literally the same time. And now you can see very different appearance. The liver really doesn't drop a lot, so there's not much in terms of iron. But what you now see is that all these things, which we thought were mets, are dropping on the out of phase.
That's really cool. So they're like fatty and
yeah. So these were just fatty nodules which mimicked mets. And then the reason why they looked so scary on T2 is because the back, so there has to be some iron in this patient, although not enough to cause signal loss on the 1.5 Tesla scanner. Remember, 3 Tesla is more sensitive. But there's enough iron here to drop the background liver on T2 enough so that all the fatty parts look mildly hyperintense and they simulate metastases on T2. And so when you put the patient on in and out of phase images on 1.5, you can confidently say, well, all these things are not metastases, they're just fatty nodules. So sometimes physics is helpful.
That's really cool because you basically can tell they're fatty nodules because you put her on 1.5T, but you were able to do that immediately.
Correct.
That's awesome.
Yeah, I forget how it happened that I caught this case. It's a fairly old case, but it did happen.
Impressive.
It did happen a long time ago. Long time ago in a galaxy far, far away.
When you had much more time on your hands.